Are you gonna go over the tests that we did, how to do?
Yes, I do
I
that
mean,
at
are
the
we
beginning
gonna-
of every class.
No, I meant the ones in the notebook. That you told us to do?
Are you talking about your homework?
I mean, the tests, the couple of the tests, right?
Right, well, I'm gonna ask if you have any questions at the beginning when I take your grades.
Oh,
I'll
okay.
ask if you have any questions.
Okay.
Did you have any specific questions?
No, I was just wondering if you were grading them and if it was the
No,
same.
that's more for your knowledge. We'll talk about that in just 1 second.
Yeah, that's fine.
You don't know going to class,
Tricia,
What
can I
class?
help you?
her class.
Oh, I just got
Oh,
them all,
right.
so I couldn't find them in my
Good, how
phone
are
because
you?
I had too much junk mail. So I started doing that. Why are they all in there? It's out.
Go over a lot of stuff.
Person.
Well, it was a teacher.
I have to start going over the routine of,
But tied into,
this
tied the
stuff.
other into it. And then we kept it, we got a separate line of service for the house. Once it was completed, we kept that people knowing that we were gonna use it, and it's attached to a light, a street light too. So that's what needs to be temporarily suspended. Right there, yes, yeah. Oh, yeah, yeah, yep. And it'll reach perfect. Yep, I have. Okay, I have the count. Okay. Yeah, I haven't gotten that yet, so if you wanna email that over. It's Laramie, LARAME .PRN@gmail.com. And I'm teaching between 9 and 1. I'm actually getting ready to start class, but I will get to that after 1 p.m. today. Yep.
Barriers are usually in the linen closet, right? They're in the linen closet though.
That's exactly what we, yeah,
Afterwards,
that's
you
exactly
know,
what we
go
wanted.
get it.
That's what you're going to do.
Then you come,
Yep.
First you teach your family.
then you come back to the room and put it down. And go back out and get it again.
Thank you so much.
You get lost and stuff.
No, you get the bed. I don't take the.
Huh?
The table will be with you.
Yeah,
Get
but
your berries. These days, the supplies.
you see, say,
I think you can take them.
that's a question I have. Huh? That's a question I have.
No. Oh, my goodness.
I always have it up.
Wednesday.
Good morning. Good morning. All right, this is the last Monday of class. Also the last skills day. So only one more class day to go. Here. Testing 1, 2. All right, looks like sound is good. We got video up. We're ready to go. All right, so over the weekend, you had 2 chapters of homework to do, 8 and 9. Did you guys do that? Grade it? 8 and 9. Yeah, 8 was on nutrition, 9 was on rehab. And then you had a couple of unit tests as well that I told you could take if you wanted to. We'll talk about that in just a minute. But if I can get your scores,
for whatever you have done. If you only did 8, just give me that one. Swanson is not here. Madeline. Okay, do you happen to have 4 and 7?
Do you have my 1?
I need 1 as well. Yeah.
The 85.
Okay. Missing a lot of people today. Taylor. Okay. Nicole. Thank you. Hillary. Hillary, do you have 7 for me?
It's 90.
Okay, so you gave me 100 for 8. Did you get 9 done as well?
9 is 100.
Okay. Thank you. Denise.
I just did, number 8, and I made a 95 on. I think the ones that, I think I had this,
Okay, so 5 and 7 is what I need from you. Okay, so that's an 85.
and I made 2 on 7. I
Uh,
made 1.
All right, so that's a 95. Very good. Good morning. Bree? Okay, no problem. Kathy Watson? Thank you. Lance? Thank you. And do you have 3 for me?
75.
Thank you. All right. And Shelley, whenever you get settled, no rush. But this is chapters 8 and 9.
For me, I got a 90 and a 90.
Thank you. All right. Any questions on those on chapter 8 and 9? Anything that you missed, but you're not real sure why you missed it? Or anybody want to convince me that your answer is more right? No? All right, so let's look at the unit quizzes. So unit 1 test, page 41. I had talked to you guys about this at the end of class and told you that this is kind of an extra thing for you to be able to make sure, because 4 weeks ago was a long time ago, and to make sure that you remember all of those principles. So this is a good review of the previous material. Did anybody do the test on page 41? Okay, how'd you do? Okay, that's okay. On page 41, does anybody have any specific questions? The answer key is in the back of the book, of course. But anybody have any questions on any of those that you don't understand? We also did the same for chapter 2 on page 58, chapter 3 on page 77, and chapter 4 on page 89. So if you haven't had a chance to do these, I don't collect these grades. These are just for you, to make sure that you have the knowledge that you need to be able to pass the state exam, because we've covered a lot of material in here. The last one was 89. And it's on your syllabus here in the homework section down here. It'll tell you when we finish that unit, so you can take that test to make sure that you got all the concepts. Is anybody feeling overwhelmed, feeling behind, feeling like you can't? Okay. Overwhelmed. All right. So what is it that you're feeling overwhelmed with?
Particularly the skills.
Okay.
On the opening, the skill, the barrier, the privacy blanket, the basic training. I have that down, the glove rules, I have that down. It's just the opening skill, the barrier and the closing that I have so much time, a tough time with.
Okay. So the opening is how we start every single skill. It never changes. And the opening is, hi, Miss Jones. My name is Patty. I'm your CNA today, and I need to, whatever the skill is, you're going to describe it. Then you're going to get permission. Is that okay? Once we have permission, we can close the curtain. What do we do right after we close curtain? Wash our hands. So that's a whole opening. And it's done the same way for every single skill we do. It doesn't matter whether you're feeding a patient, same opening. If you're changing an occupied bed, same opening. If you're doing range of motion, same opening. It doesn't ever stop. Okay, it's always the same. There's no skill where we don't do the opening.
This might sound crazy, but when you go and you do that, you get a barrier. You just get the barrier, so you're walking out of the room, going to the linen closet, getting the barrier, coming back, and going back again.
Okay, for the test, the linen room is right there, right beside you.
So that's a.
So yes, but let's talk about that for just a second. Okay, let me turn that air off. So that's not a crazy question. So let's say that you want to make fewer trips, especially if the linen supply cabinet is down the hall, right? So you want to make fewer trips. So if you do your opening, knock, knock, knock. Hi, Miss Jones. I'm Patty. I'm your CNA today. How are you? We need to do this, whatever. Is that okay? Close curtain, wash hands. Opening, always the same. Now that you've got clean hands, you can go get your clean supplies. But if you want to make fewer trips and you try to grab everything at one time, when you're trying to spread that barrier out on the table, you're going to need a hand for that, which means now you only have one hand for your supplies. And most of you will end up like this as you're trying to spread the stuff out, the chucks out. So you end up contaminating your supplies before you ever use them. So that is an infection control checkpoint. So our rule is that we go get the barrier first. That's the first thing we get. We put the barrier down and then we go get the rest of our supplies so we're not holding them up next to us. Okay. Can you just gather your supplies and then go in and do your opening? Why?
Because
They got to have clean hands, and it's implying that the patient is going to cooperate. It basically takes their ability to refuse out of it. That's no good. So, yeah, it's super important that that order is followed. It's that order for a reason. Okay. So does that help you with the opening and with the barrier? Okay. So which other ones did you have a question about?
Closing.
Okay, the closing is done the same way at the end of every skill. So just like every skill starts with the opening, it's going to end with the closing, always the same. The first 4 items that you're going to address, the order doesn't matter. Nobody cares. So they need their call light when you leave, right? So you got to give them a call light. They need we need to know that they're comfortable. They need to be comfortable. So they actually need to hear you say that. Are you comfortable? They also need emotional comfort. So we're going to offer them a magazine, something distractive, emotional. We don't want them bored. So we're going to offer a magazine. So call light, comfort. We're going to open the privacy curtain. And we're going to make sure that the environment is clean before we leave. So those 4 things have to be done before we can leave the bedside. Comfort, curtain, call light, clean. Nobody cares how you do it. You want to give them the call light first? That's fine. You want to open the curtain first? That's fine. Same patient cooties, not an issue. But once you get those things done, then you have to go wash your hands or clean your hands. So we're cleaning off all the patient's cooties. Now, once we've washed our hands, do we want to come back to the patient? Why? Cooties, yeah. You come back to the patient and touch anything, you've got to go rewash. Now, if charting is required, remember you will get one charting skill. Everybody gets one charting skill. If charting is required, if you're going to document something, then you're going to do it after you've washed your hands so that you're not contaminating your pen. And then you're going to go wash your hands again, just in case that pen contaminated you. That's the closing. And it's always done the same. So your closing is going to sound something like this. Thank you very much, Miss Jones. Are you comfortable? Is there anything else I can get for you while I'm here? Let me just open your curtain. Here's your call light. If you need anything at all, please press the button. Your environment is clean. I'm going to go clean my hands now. Once I've cleaned my hands, I'll chart if necessary and clean them again. And then I'll think about my skill, probably read the care plan one more time, make any corrections, and tell the evaluator my skill is done. Okay. Does that help?
It does.
Okay. Any other questions? So at the end of last class, I actually gave you a study sheet, a fill in the blank study sheet. It was actually 2 sheets. And it went over every single principle that we have covered. So all the steps of the opening, the steps of the closing, the steps of skill rules, barrier, glove rules, privacy blanket, linen rules, scoot and roll, washing rules, shoe rules, basin cleaning and closing. It went over all of them. If you can fill in that fill in the blank sheet that I gave you, you have the knowledge you need to be successful. Okay. Now you got to apply it. That's kind of the hard part. Any other questions on what we've gone over in class?
They can also, by the fingertips,
Mhm.
the thumb is underneath.
It's going to be kind of on the back side. So if I find my pulse here, remember the pulse is at the thumb side, right? We don't use our thumb. If I put my fingertips here, I want to put my thumb on the back side, like a C shape to hold consistent pressure. Okay. Right, because that's what our care plan says. 1 whole minute. Yep, don't use your thumb. So down a little bit more. At the base of the thumb. No, you're way too high. It's that you don't want to be on the bone. You want to be below that bone. Use your fingertips, put your thumb on the back side. Yeah. Okay.
When we're doing blood pressure, so we put it on and we put our stethoscope and all we're listening for is the first step and then the last step. We don't have to look at a time to find it.
No, there's no time for blood pressure. We're just listening for where we heard the first thump, where we hear the last clear thump, and whatever numbers those are the blood pressure. No, time is for pulse and respirations, not blood pressure. So for blood pressure, it's just what we hear. Any other questions?
On the test, are we allowed, like when you put the little alcohol thing on his stomach, we're allowed to do that?
Yep. You are absolutely allowed to do that on the test. I'm going to steal one of these chairs. Guys, I apologize. I usually don't sit while I'm teaching, but today I'm going to have to sit for a few minutes. My knee is not cooperating. So I just want to sit for a second. Yeah, sorry. I'd like to be a little more professional than this, but my knee just won't let me. Oh, thank you. All right. Any other questions? We're down to the last 3 skills. This is it. This is it. And I'm actually going to have it done pretty quick this morning. Because there's nothing or not a lot really new to teach you. What we're learning are variations of skills that we've already learned. So we're going to learn another range of motion. Well, we've learned 2. We know the process. So we're going to look at the care plan to find out what body part we're supposed to be exercising, what exercises we're supposed to do, and how many repetitions. And then we just do the exercises. So remember, flexion extension is up, down. Abduction, adduction is a side to side. Rotation is around, right? So that's not a hard skill. Catheter care, do you guys remember pericare? Yeah, catheter care is even easier because you don't have to turn the patient over and clean the backside. We're going to clean the front part of pericare just like we did with pericare, and we're going to clean the tubing. So it's even easier than pericare because you don't have to turn the patient over. Right? And then we're going to learn how to empty the drainage bag, which is literally a 3-minute skill, but it's a lot of infection control. So we have to talk about that quite a bit. So you'll have about roughly somewhere around 2 hours of practice today. Okay, and that should help you with feeling a little more confident with the skills. But I know I asked you if, who's feeling overwhelmed. And almost all of you raised your hands. So what are some things that you're feeling overwhelmed about that I can help kind of de-escalate you a little bit? Okay.
I feel like I have it down like to a point. It's just when I get put in a situation like do this now kind of thing, I freeze.
Most people do. And the evaluators, the one thing you need to understand about the evaluators is they're not new. They've been doing this a long time. They know what it's like to be in your shoes. They expect you to be nervous. In fact, if you go in there super, super confident and acting like you've done this your whole life, they're probably going to look at your skills a little bit harder because you're not the typical, right? So everybody's nervous. Nobody likes to be watched doing anything. Nobody's going to wake up on test morning and go, yippee, I get to go test today. I mean, that's not, everybody has anxiety over the test. I do this for a living. I know this test inside and out. I have studied the test for a very long time. But if I had to get up tomorrow morning, and remember, I teach, and interestingly enough, Prometric uses my videos to train their evaluators. Okay. So if I went to test tomorrow, I would still be nervous. Why? I mean, I am probably the most qualified person in the world to take the Prometric CNA test, but I would still be nervous. Why?
Eyeballs.
That's right. You're being watched. Everything that you do is being scrutinized. And that gives you a lot of anxiety. You also know that you have to pass this test to be able to get into the workplace. That's a lot of pressure. So they understand this. Okay. And they're not trying intentionally to fail you. In fact, for my students, it's actually pretty hard to fail because you know these principles inside and out. You'll look at a patient, a mannequin in the bed. If they are exposed and undressed and naked, your brain will automatically trigger, that's not right, because of the way I've trained you. So I've actually kind of gone around you and went straight to your brain for this skill or for this class. You're not going to realize that until you're in the test. And chances are you're going to be paired with somebody else that wasn't one of my students. And you're going to get to see the difference in the way you were trained and the way somebody else has been trained. And there's a big difference. I train you a certain way to make sure that you pass. But it's not just enough to pass the test, is it? What are we training for? Yeah, the day after the test, when we go to work and work on real live people. So that's really the focus here. On the test, they don't care about you. You don't matter on the test, not a bit to them. The test is not about you. Their entire focus is on the patient in the bed. Are they too close to the edge? If they are, do something about it. Do they look uncomfortable? If they are, do something about it. Are they exposed to the world? If they are, do something about it. Does the patient know what you're doing? If not, do something about it. So you know the things that they're going to be grading you on just because of the way that I've taught you. You don't have confidence in you, but I'm hoping you have some confidence in me. And that's what's going to kind of get you past the test. Okay, does that make sense? My students truly have a hard time failing. You're going to be okay. That doesn't mean you shouldn't practice. You need to. You do need to practice, but you're going to be okay. The written test, you guys are all going to be okay on the written test because as we've talked through all of I haven't just shown you the skills. Did you guys notice that? I didn't just show you, okay, this is how you do hand and nail care. I talked to you about it quite a bit first. We learned about how skin thins as we age. We learn how we lose the fat layer as we age. Those are all topics that are going to be on the written test. So even though I was teaching you skills, I was actually incorporating the theory that you're going to be facing on the written test as well. Because in a clinical setting, they aren't two separate things. They go together. People like to try to separate them out, but that there is no separation. In order to effectively brush somebody's teeth, you need to know a few things, right?
For the written test, did we get something similar to it that we practice on, or is this?
So in your white skills book, your spiral book, turn to page 142. This is a full 60 question practice test, very similar to what you would get on the state exam. In fact, the students tell me my test is harder than the state exam. So if you do okay on this, you'll do okay. But don't take this test until you've finished your reading. Make sure that you've done your reading first. That's why I don't tell you about this test on week 1. Okay. So sometime tonight after you read chapter 10, that's a good time to take this test. You can grade it. The answer key is in the book and see how you did. I also have a practice test on my main website for your CNA.com. And that one is like a true test. You answer every question and then you submit it and it'll give you your grade and then your feedback. But it doesn't answer the questions as you go along. So it's more like a real test. Okay. So I have that available for you too. Inside the online program, remember that program I gave you the invitation to on the first day? There are thousands of questions I have written inside that online program. And then there's the ebook. Anybody download the free ebook? You probably want to do that. Yeah. So go to my main website for your CNA.com. At the very top, you'll see get our first ebook. It's 74 pages on how to pass the written. Sounds like a lot, but the book is kind of small. You know, it's like half the size of a regular book. And in there, I have follow along activities. So you see the question, and then we actually break down the entire question and every single answer to figure out what they're asking us and how we need to answer it. And I do that on multiple questions. It will help you on the state exam. It will.
It's off for your CNA.
For your CNA.com. Right at the very top of the page. So I have a lot of resources for you guys. I have a lot of things to help you. That's okay. You're fine. there's a lot of information that we have developed over the, the years to help you become successful. It depends on how much you want to use. Okay. So good. You guys know the resources you have now. We'll go over it again on Wednesday. In graduation, I'm going to give you a folder that has all of the resources we have, and we'll remind you. Remember, all the follow-up emails that I've sent have had a ton of resources in those as well. So if you haven't opened those emails, you probably want to. One of the things that I'm going to be doing, I've got most of them written. I'm very, very close. But one of the things that I'm going to be doing is I actually have an entire email series that's going to go out to students, one per day, that goes over a different topic about the test. So how many can I miss? And it's just a little, information. What are they looking for hand washing? What are the important checkpoints? So I've got, but it's one a day for 6 weeks. So it's a 6-week boot camp, of emails that just go out little by little. And I don't know that it'll be done for you guys, but I'm almost done with it. When I do have it, it'll be on the main website. Sign up for our 6-week email boot camp. You just click on it and sign up. Okay. And those emails will help you get ready for the test too, because I say a lot of things in here. I cover a lot of information, and you probably don't remember every word I've said. I mean, in reality, adults only pick up about 70% of what's being said. Yeah. 30% is a whole lot to miss. So if you haven't gone back and rewatched the live sessions on YouTube, put me on double speed. Listen to it while you're walking the dog or doing your dishes or cooking your Thanksgiving. Okay. I did my Thursday live. I don't think any of you guys normally join, but on my Thursday live sessions, do you? Oh yeah, I did. On my Thursday live this week or last week, I covered documentation. That would be a really good one for you to go back and watch, because it's not something that I cover in class. So those live question and answer sessions, those are, it's a lot of additional information that I don't always get to in here. And I answer questions from the audience as well. So you probably want to work that into your routine before testing as well. I don't have one this week. Thanksgiving, I'm going to be cooking a turkey. So for lots of people. Oh boy, good luck. All right, any other questions before we move into today? Any other questions? No? All right, so go to page 57 in your skills book. All right, so this particular skill tells us to perform passive range of motion to the hip, knee, and ankle. When we're doing range of motion, we have to follow the recipe. Whatever the recipe tells us to do is what we're going to do. So this particular skill, if you look at the top of the page, it's going to tell you to perform passive range of motion to the hip, knee, and ankle. We're going to provide the following range of motion exercises to the resident's right hip, knee, and ankle flexion extension. So if you remember, flexion extension was just up, down. That's all it is, up, down. So this says hip and knee, and the hip and knee is always exercised together at the same time, because straight leg raises to do flexion extension of the hip If you have somebody laying down on their bed like her, and you raise one leg straight up, if they have lower back pain or sciatica, it's very, very painful. It's very hard on the back. So we don't do that. We want to bend the knee at the same time. So if you lift the leg and you bend the knee to the chest and the knee and the hip both bend, let me show you real quick. So if you're looking at me, right, my leg is straight, my hip is straight, my knee is straight. If I bring my knee up toward my chest, my knee is bent, but so is my hip. So it's a 2-for-1 exercise. We always lift from below with a flat palm. We want to watch for signs of pain, but we're going to lift the leg, bend the knee toward the hip, just to the point of resistance, right? We don't like pain. What do we do if we get pain? Yeah, stop. Stop. Go below the level of the pain next time and let the nurse know we got some pain. But the first exercise, we're going to lift the leg, support at the 2 joints, bend the knee to the chest, and then back down to the bed 3 times, because it tells us 3 times. And then we're going to do the same thing with the ankle. But your patient's laying in bed. So that means their heel is flat on the bed. When you flex and extend the ankle, so you push a foot forward and back, what that does is it causes the heel to scrape against that sheet. Now, if your patient has any sort of skin issues or dry skin or pretty much anything, that can actually tear the skin. So when we are exercising the ankle, we want to lift that heel off of the bed just a little bit, bend it forward and back, forward and back, forward and back. Ask about pain. That's the whole skill. That's it. That is all we have to do. So knee to the chest 3 times, lift the foot back and forth 3 times, do an opening before and a closing behind, and that's the whole skill. It doesn't get much easier than that.
The whole leg go back down.
Right, because we always return to start. Yep, we always return to start. Okay. I need a volunteer, somebody to go lay down in the middle of that bed. Okay. There we go. Okay. Wrong way. All right. Let's go to. And then we have the side view here as well. Okay, I'm going to do this skill. I will simulate hand washing just for the sake of time. And this does tell us to exercise the patient's right hip. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I need to do some exercises on your right leg. Is that okay? All right, I'm going to close your curtain. Let me go wash my hands and I'll be right back. I have clean hands. All right, Miss Jones, I'm going to do all the work. All you have to do is let me know if there's any pain or discomfort as we do this. First thing I'm going to do is lift your leg off the bed and bend your knee to your chest and back down to the bed. If you're uncomfortable, let me know. So under the knee, under the heel, bend the knee up. Feel okay? All the way back down. That's 1. I'm going to do this 3 times. Up, all the way back down. That's 2. 1 more. Up, all the way back down. That's 3. Good. So now I'm going to move on to the foot. I'm going to lift your foot off the bed, bend your foot forward like you're stepping on the gas pedal, and then back to your head. You should feel a gentle stretch, but no pain. Okay, so we're going to bend forward, feel it stretch. That's one. Okay. Okay. Forward and that. Good. One more. Forward and that. Good. Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here? Okay, let me open the curtain. Environment's clean. I've got to find her call light. Okay, call light's here. If you need anything at all, just let us know. I've washed my hands. Go back and review the care plan. Make sure, did I do the exercises on the right side? Did I do flexion extension of the hip and knee? Did I do flexion extension of the ankle? And did I do them 3 times each? Did I monitor for signs of pain? I'm happy with my skill then. I can tell the evaluator my skill is done. But if I needed to, thank you. If I needed to, I could make any corrections. You know, if I had done something, if I had done the left side instead of the right and realized it. So I can make corrections up until I say my skill is done. Okay.
So we have to say we about to start, and we have to say we finish.
Yeah, you will tell them when you're ready to start the first skill. After that, you don't really have to announce that you're ready to start the second skill or the third. They know that when you knock, because your time is still running. From the time you start your very first skill until you end your last skill, that's the timer is running. Okay.
We have 3 skills that we have to be assigned.
Right. That is correct. Yep. Out of 21, there's 3 you have to perform.
The 3 skills in the written portion, or it's both get the CNA license, is that right?
You have to pass both sections. Yes. The written and the skills. Yes. Yeah, they start the same and they finish the same. I mean, all you have to learn is the stuff in the middle. Yeah. But remember that the stuff in the middle isn't what, it's not the majority of the checkpoints. Right. The majority of the actual checkpoints for, if you look here, these are the actual checklists. These are the checklists that you're going to be graded on. The checklists. So out of just for fun, let's look at mouth care.
Where's the checklist?
You don't have them in your book. I use these to make your step-by-step instructions. These checklists are actually written for nurses, not for students. I mean, you can get some stuff out of it, but what I did is I filtered this through my nurse brain, and that's how I came up with the steps for you. Okay. So this is provide mouth care to a resident who has teeth. Okay. So when I read the step, I want you to tell me whether it's a principle, something that we do in lots and lots and lots of skills, or whether it's specific to mouth care. Okay. So let's see here. Greet the resident, address by name, and introduce self. Which principle? Okay, all of them, but specifically, which one? The opening, right? So checkpoint number 1 is checked off if you do your opening. Good. Let's go to checkpoint number 2. Provide explanations to the resident about care before beginning and during care. Do we have to describe our skill during the opening?
Yes.
Okay, so checkpoint 2 is satisfied during the opening. Okay, so right now we got 2 checkpoints out of 16, and we haven't even started this, anything related to mouth care. That's just the opening. Assist the resident to a sitting position in bed by raising the head of bed. before offering fluid or brushing teeth. Well, that's pretty specific to mouth care, right? We have to put the head of the bed up because we're doing. So we finally found one checkpoint that has to do with mouth care. Protect residents' clothing before providing mouth care and remove protective cover when completed. That actually falls under linen rules, right? We want to protect their clothing. Moisten toothbrush with water and apply toothpaste. Well, that's mouth care specific. Wear gloves when brushing residents' teeth. Well, we have to figure that out with glove rules. So that's a principle. So right now we've only got 3 checkpoints out of 16 that have anything to do with mouth care. Everything else is just a rinse and repeat, something that we do all the time. Brush sides and biting surfaces of teeth. That's mouth care. Offer the resident a cup of water, mouth care, and provide an emesis basin for them to spit in, mouth care. Okay. Leave area around resident's mouth clean and dry, mouth care. That's it. That's all they're grading you on for mouth care. That's it. Just those steps. Because now, complete skill having rinsed, dried, and stored the basin, we have a whole principle for that. Right? Ask resident about preferences during care. That's in the opening. Refrain from touching resident before hands are clean. That's the opening. In the skill with clean hands, that's the closing. Avoid holding clean or dirty linen against against our clothing. That's linen rules. Ask resident about comfort, the closing. Announce self or knock before entering the room, the opening. Refrain from addressing the resident using terms other than their name, like honey or sweetie. So that's the opening because we address them by name. Leave the call light in or near the resident's hand at end of skill. That's the closing. And leave bed in low position at end of skill. That's the closing. So this skill, 90% of it, these checkpoints, is the opening and the closing. There's only 6 things here that we're doing to demonstrate mouth care. Putting a towel over their chest, wetting a toothbrush, putting toothpaste on it, brushing all surfaces, letting them rinse and spit, and leaving their mouth and clothing dry. That's all you're being graded on for mouth care specific. The rest of this is all the opening and closing with a few linen rules thrown in. So there's not much there that you have to learn, right? Would you brush somebody's teeth without gloves? No. So you automatically know that. If you're going to get supplies, what do you need to put them on? A barrier. You already know that. You don't need to learn that for this skill. You already know that. If you're going to clean the basin, you already know how to do that too. Rinse it, dry it, and store it. We've done that. So when it comes to these checklists that they're checking you off on, usually, because remember, I use these to create your how-to in your book, but usually about 60% of each of these skills is made up of the opening and the closing. That is where most of your checkpoints come in. And that's why that's the very first thing that we learn, so that you hear it over and over and over and over. The opening and the closing are the most critical things that you need to perform during the test. Okay. Now, something that comes up a lot is in my live weekly question and answer session is I've heard they're not testing mouth care, denture care, and feeding. And right now that is correct. They are not testing anything that requires you to be unmasked in the testing center. So to feed somebody, of course, you have to unmask. To do mouth care, you have to be unmasked. So, or the patient, I'm talking about the patient, but so anything that required that you were unmasked, they suspended for the test. I expect, and I have gotten some pretty reliable intel that is resuming in the very near future. Very near future. So for your test, chances are those will be back in play. But we shouldn't just use, I mean, we shouldn't use that as an excuse not to practice them though. Because yeah, you're going to be doing this on real live people. So we need to make sure that we're practicing. Okay. Questions? So I had an instructor contact me from North Dakota this weekend. I didn't even realize there were people in North Dakota, to be honest. That is way too cold for me. I am a Florida girl. That is not somewhere that I would sign up to go. But she is teaching a CNA class, and she was asking what the difference is between what we teach and their tested standards. So I did a little bit of research for her and typed out this huge amount of information to send her. But it's interesting. I like doing that to be able to compare different states and what they test on. So some of the skills, right? You guys think 21 is bad. They've got like 32, but some of their skills had me laughing. So one of their skills is passing fresh water. Yeah, passing fresh water. That's a skill. They also had, for partial bed bath, they were just told to wash the face, one arm, and hand and underarm. So not the chest, not the abdomen, not the back, nothing like that. They also had to apply TED hose or anti-embolism stockings, which I do have a video on that now. We don't have to do that, but it is common in other states' testings. So it really is kind of interesting to see the differences between our state and North Dakota. And I went through all of their checklists. And they do have some differences, but it basically what I wanted to tell you is Prometric is one of the easier testing processes companies because everything is uniform and it's all completely spelled out. So there's no trickery, there's no wiggle room. You either did it or you didn't do it. It's a very methodical, well thought out test process. And that's a good thing for you guys. Okay. Don't stress the test too much. You'll be okay. But you do have to practice. Okay. When you're doing the skill, I do want you to talk to the patient though. If you notice throughout that entire skill, I told her every step I was about to do before I touched her. So I said, I'm going to bring your knee up to your chest and back down to the bed. Let me know if there's any pain. I'm going to lift your foot off the bed and you know, press your foot forward and back to your head. You should feel a stretch. So if remember, your patient hasn't taken a CNA class. They have no idea what you're doing. They don't know if it should hurt because every other person that's walked in that door has hurt them. So we really got to make sure that we're communicating with our patients really well. And this is something they're going to be grading you on in the test is your communication, bedside manner. Make sure that you keep that in the front of your mind too, because you're going to be nervous for the test. And it's really easy to start focusing on you. Take a step back and focus on that patient. If you do that, you will be successful at the test. You will. Okay. All right. So let's look at catheter care on page 114.
My hands are just okay now.
All right, catheter care. We've seen this before. Last week, we reviewed a normally functioning urinary system. We have 2 kidneys. Those kidneys filter blood. How often? 24/7, never stops. And it creates urine from the waste products. Those urine drops go down tubes called ureters and collect in the bladder. You guys remember that? Remember that the bladder is the ideal breeding ground for, pathogens, all the bad guys. So when we put a catheter in, nurses put catheters in. CNAs don't put catheters in. Nurses do that. You can be trained to take them out. It's actually I'm going to show you. I know right now you're kind of freaking out, but it's super easy. You can be trained to take them out. You can be trained to do additional tasks other than what you're trained for in this class based on where you go to work. So let's say that you go to work in a same-day surgery center and you go to work in pre-op. This is getting people ready for their surgical procedure. So you're basically giving them their gowns, telling them to get dressed, taking their, history, that kind of stuff. You're working same place, but you're working in post-op. Well, you're not going to be getting them in gowns or getting their, information. You're actually going to need to get them ready to go home. Well, in this process, they got themselves an IV and probably a catheter because we usually use them in surgeries. We don't want, when we put you to sleep, we put all of you to sleep, including that valve. So you will pee on our sterile field. So we usually put a catheter in while you're in twilight. You probably don't even know it. Just to collect the urine during surgery because we don't want you peeing on our surgical table. Makes sense. So at the end of the day, you're getting them ready to go home. Well, that IV's got to come out. They're not going home with the IV, and the catheter is going to have to come out because they're not going home with that either. So you may be trained to take those items out. Now, you wouldn't need that training because that does not relevant to what you do with those patients. So even though you're both CNAs and you work in the same place, you would have different tasks to do, and you're going to have different training for those tasks. Now, training doesn't have to be in a classroom. Training can be at the bedside. Training can be in a training coordinator's office, right? So it doesn't have to be classroom training. But training does have to be thorough. You have to understand what you're doing, why you're doing it, and how it's going to be done. And then you've got to be able to answer some questions on that to make sure that you've got it. And then I'm probably going to ask you to show me. Do that skill on this mannequin right here. Show me that you know how. Okay. So it's called return demonstration. Good. Make sense? But it's important to understand that training doesn't have to be classroom based. What if somebody asks you to do something and you haven't been trained? Tell them. Yeah, I don't know how to do that. I'm willing to learn, but right now I don't know how to do that. You need to help me out here. I need some training.
Don't pretend.
Don't pretend. Yeah, this is not the time to pull up YouTube videos and try to learn on your own. All right. So when we have a catheter, kidneys are still filtering blood 24/7. They're still producing drops of urine, drop, drop, drop. Those are still going down ureters, drop, drop, drop. They still go into the bladder, drop, drop, drop. That system does not change. What changes is that we're going to put a straw in there to hold that valve open and collect the urine. So we're keeping the bladder uninvolved. So any urine that gets into the bladder, it's just going to go down these little holes in the catheter through the tubing and collect in a bag. That's it. So think of this bag like the bladder. What do we know about a bladder? It's the ideal breeding environment, right? Well, this bladder is inside the body, but we're bypassing it. Now we've got a bladder out here in the open. So that means we got to take really, really, really good care of this bladder because we know everything wants to get in it. Okay. Good. Let me show you what a catheter is and how it works. I find it's helpful. You don't have to do anything with catheters other than keep them clean, but I do find it helpful for you to be able to see it and touch it and feel it and kind of learn how it works so that you're no longer afraid of it. Because right now you've got a pretty healthy fear of catheters. My goal is to reduce that fear. Okay, so there's two different types of catheters. This is an indwelling urinary catheter, which means we put it in and it stays in. Indwelling. Also called a Foley catheter. You'll hear it called a Foley way more. Foley catheter. And a Foley catheter has a little bubble on it that we can inflate with fluid like this. And all that's going to do once we get the catheter in the bladder, it's like this until we get in the bladder, right? It's no bubble. Once we get it into the bladder, we're going to fill that balloon up with water, and that just holds it in the bladder. It acts like a little doorstop. Right, exactly like G-tubes, yes. Now, if we want to take this catheter out, let's take the water out.
Yeah.
So then it just slides right out. So this is flexible. It's like spaghetti. I mean, it's the thing about catheters, though, is that we're holding that valve open. So if we don't have a big enough catheter, right, this has got to fit snug. If we don't have a big enough catheter, because we're holding that valve open, if the catheter is really small, we're going to get leaking around the catheter. So when we put a catheter in, it's got to fit pretty snug going up. It's not painful, but I wouldn't call it comfortable. Okay, because it's got to fit snug. It's like those of you with pierced ears, it's like wearing a bigger, heavier earring than you're used to. It's uncomfortable. Probably going to irritate you. Does that make sense? But two main types of catheters. This is the Foley cath or indwelling cath. And then this one is called a straight cath. The difference between them is that the Foley has the bubble that we can inflate with water. A straight cath does not. There's no bubble. So this is temporary. We put this in just to get a urine sample, and then it comes right back out. It doesn't stay in. This, if you put this in and just kind of leave it alone and you know, take your hand off of it, it'll slide right back out, because there's nothing to keep it there. That's why we need that little balloon at the top of a Foley to keep it in place. Now, Foley catheters or indwelling catheters, they can stay in for up to 30 days at a time. So a nurse would have to change that out every 30 days. The bag that that catheter is attached to needs to be changed out once a week. So that means that the catheter and the bag where they connect, which is right here, where they connect, will have to be separated and a new bag put on. This is not something that a CNA does unless you've been trained to do. So this would be additional training. The reason for that, remember that every pathogen is trying to find a bladder to get into, and they only have to climb that far if we allow bacteria in here. So when we separate these two pieces, we have to be super mindful of everything they touch, all potential pathogens. And that's why you have to be trained on that. So for CNAs, entry level, you're going to be trained on cleaning the catheter. We're going to use the leaves method, right? And you're going to be trained on emptying the bag. We're not trained on changing the bag. So clean the catheter, empty the bag. Those are the last two skills we're going to learn. Good. All right. But I told you that I told you that, I totally lost where I was going. Hold on a minute. Oh, okay. So these catheters are put in place by nurses, and then the nurse is going to inflate this. It's going to fit snug, not painful, but uncomfortable. When your patient expresses discomfort, and a lot of times they're going to say, I feel like I have to pee. It's very, very common when you have a catheter, patients feel like they have to pee. Well, the reason for that is this. If we have a bladder that's normally filled with urine and we put a catheter in there, we've got this little tip here, this little tip that sticks up. And because we're keeping the bladder empty, the bladder's small, right? Because the bladder expands when you put urine in it, and then, but we're keeping it empty, so it's a little bit smaller, right? So that means this tip is likely to hit the top of the bladder. There's only one thing that has ever hit the top of the bladder. Anybody know what that is? Pee. That's it. That is all that has ever hit the top of your bladder. So when the bladder feels this, what does it think? Gotta pee. Make sense? So patients that get catheters often feel like they have to urinate. A lot of CNAs will say, just go. Well, there's no just going. They can't open the valve. It's already open, right? There's no just going here. And now your patient's trying to figure out, how do I just go? I don't know how to go. And they think they should be doing something. Instead of saying, just go, you've got a catheter. It's better to say, that's okay. That's normal. Just distract yourself. And that sensation goes away like 10 to 12 hours. Watch a movie, read a book, take a nap. The bladder gets used to it being there. But yeah, 10 to 12 hours, it's a bit irritating, doesn't belong. Now, sometimes your patients will pull it out, especially patients that are confused, dementia, maybe sedated in the ICU. They'll pull it out. It's okay. It's all right. I mean, it's just soft tissue, right? We've got a balloon this big going through a space this big. You are going to have a little bit of tearing, maybe a little bit of blood, but that's okay. They're fine. They're fine. But with every injury comes swelling. And this is probably not a place that we want swelling, right? Because that could keep us from peeing. So if you get a patient that pulls this out, you need to let the nurse know right away, because I've only got 45 minutes to make a decision. If I wait longer than 45 minutes, I'm not going to get another catheter in. It's going to be too swollen. I can't. Remember, they already fit snug. If it's swollen, I'm not going to be able to get a catheter in there. So I need to know right away. Don't run. It's not an emergency, but let the nurse know right away. You also need to keep this whole assembly for them. Because if I have a patient that pulls the catheter out, I need to look to see, is it intact? If it looks like this, the bubbles there, everything's in place, this is easy. I can deal with this. But if it looks like this when it comes out, this is a problem, because that bubble bursts, and that means that part of this may still be inside the patient. And that can cause a rejection reaction. And that can be very serious. So this, the doctor has to get involved. This, we're good to go. The only way for me to know is to look. Good? Questions so far? Okay, so I'm going to pass all of these around so you can see what a catheter looks like when it breaks. Yeah. It's all my talking.
Talking about peeing.
So you can take a look at each one of those. All right, so when we have a catheter in place, it's important to know that this bubble is holding that valve open. This whole system is holding that valve open. Now, in a clinical setting, when we have a catheter, remember, every bacteria is trying to get up into that into that bladder, and we've now held the valve open for them. So it's like we've rolled out the red carpet and said, here you go. And we're even going to make it easier on them. Remember I said that in the urethra, we have a couple of bouncers hanging out that's trying to get rid of bacteria that come in. Well, what we've done is we put a secret tunnel in, and now those bacteria don't even have to see the bouncers. They got a secret tunnel right past the gate into your bladder, easy peasy. This is a huge risk for urinary tract infections. Huge. So the number one sign of a urinary tract infection in the elderly is not the same as it is for young people. Now, women are more prone to urinary tract infections because remember, our urethra is only about as long as our pinky, not far for bacteria to travel. But it's I just want to let you know when he's done. You can grab that if you want, Shelley. So when we have a catheter in place, we've got to be super, super, super careful not to allow any bacteria into the system at all, because it will multiply and it will climb and multiply and climb and multiply and climb. And we end up with a situation like this. Because those pathogens are inside the catheter, we never know they're there and they keep multiplying. So by the time they jump out of the hole here, it's not 1 or 2 bacteria, it's 1 or 2 trillion. It's an overwhelming invasion that your body is going to have a really hard time dealing with, because it's not slow onset. It's like all of Canada on Spring Hill right now. It's overwhelming. Now, younger people, when younger people get urinary tract infections, they usually get pain, burning, frequency, like I can't get out of the bathroom because I feel like I always have to go. It's kind of miserable, actually, to have a urinary tract infection as a young person. The problem is that those symptoms go away as you get older. So you can have a urinary tract system, have no pain, have no burning, have no urgency, have no frequency. You have no symptoms at all except confusion. Confusion is the number one symptom for older individuals that have a UTI. So if you have a patient that's, normally pretty with it, and today he's like all over the place, has no idea who you are or who he is, where he's at, or anything, don't assume, oh my gosh, he's old, he must be getting Alzheimer's. Sudden is a change that must be acknowledged by the nurse. Gradual is how dementia progresses. Gradual. Sudden is a serious now problem. Okay, does that make sense?
Almost kidney failure.
Wow. Yeah, not everybody has symptoms. Yeah.
She's like, you could have waited another day or 2 and your kidneys would have failed.
It's serious. Yeah. It can be very serious.
It's painful when it gets to that point.
Oh, yeah.
Mm-hmm.
Yeah. So this is a catheter that's attached to a bag, and it's a closed system. That means that there's nowhere for bacteria to get in here other than the port that we drain it through, this part that we separate to change out the bag, because there's different types of bags we'll talk about in a minute, and this end of the catheter when it's introduced, when it's put in. So those are the only 3 places that bacteria can get in. As CNAs, we only have to worry about one. Because remember, we don't do this part unless we're trained, and we never do this part. So we only have to worry about one. We're going to get into that on the next skill. But keep that in mind. This is a closed system. Any bacteria that gets in, it was us. Now, a couple things about drainage bags. You never want them on the floor. right? Remember, floors are not clean areas. We don't want bacteria on this port or anywhere in the area. So these bags cannot touch the floor. But we also don't want to raise them above the level of the patient's hips because all of that urine will run right back into the patient. And I don't know about you, but recycled urine, pretty high on my gross meter. Okay. So don't lift it above their hips. So not on the floor, not on above their hips. You want it to a non-moving part of the bed above the level of the floor. Good. The tubing should be coiled on the bed, not near the floor. Because if I'm walking along here and the tubing is near the floor, my feet can get tangled in it. And that could be a bad day for everybody. Okay, so tubing not coiled near the floor. If the patient does pull out their catheter, you need to save it in a bag. Just in all clinical settings, in the bottom of the trash can are extra trash bags. So just get a trash bag, put the whole assembly in the trash bag in the bathroom. Go get the nurse. Hey, so-and-so pulled out his catheter. It's in a bag in the bathroom for your inspection. And that's pretty much all you have to do. Okay. But patients don't pull out catheters nearly as often as we do. CNAs pull out way more catheters than patients. Because if you're rolling a patient over in bed and you don't catch that they have a catheter, you'll roll them and that will just, remember, it's just a little soft bubble that's holding it in place. That can be pulled right out. If you're transferring a patient out of bed and into a wheelchair or ambulating a patient, walking a patient, if you don't realize they have a catheter bag and you stand them up and start walking, it'll pop right out. Walking by beds, getting your feet tangled in the tubing is a really good way to pull out catheters. So these things get pulled out quite a bit more by CNAs than patients, because patients will tug a little bit, but that might hurt. They'll stop tugging. Not always. Sometimes they will pull it out, but we need to understand that we are responsible for way more catheter extractions than patients are. Does that make sense? So watch where your catheters are. Always look to see. All right, so our catheter safety is the bag must be below the hips at all times. The tubing is going to be coiled on the bed, not near the floor. The bag is hung from a non-moving part of the bed. We're going to look for the catheter before we move any patients. Always look to see if they've got anything attached. And we're going to report any patient that's tugging on the catheter because they might pull it out. So as an RN, when you come and let me know, hey, there's a problem with a catheter, I've got to figure out what we're going to do about it. Remember, that's the problem that needs to be solved. If we don't need a catheter, if the patient can pee on his own, then we're not going to use a catheter. If they can pee, let them pee. The only time that we're going to use catheters is if when they pee is inconvenient, like during surgery or during childbirth, right? It's an inconvenient pee time. Because when you push a baby out, you know that's not selective, right? You're pushing everything in your body out all at once. Yeah, it's not selective pushing. So a lot of times we'll put catheters in for that reason. If you get an epidural and can't walk to the bathroom, well, we'll put a catheter in. Surgery, we'll put a catheter in. But we don't use them for convenience. If a patient is incontinent, that's not a reason for a catheter. He's coming out. We're just going to clean him every 2 hours around the clock. Okay. Catheter care is going to be done once a shift. We're going to clean the catheter and the skin around it once a shift. We'll also inspect that catheter to make sure all of these have been addressed. Good. Again, don't hold that bag above the level of the hips because it will cause the urine to be recycled. Don't trip on the cords. And make sure anytime that you roll a patient, you roll them away from the catheter bag. Okay, but you want to look to make sure that you're not trapping that tubing against the bed. If there's not enough room, then you can move the bag. Just be careful not to raise it above the level of their hips. Okay. And we talked about this. Waist catheters are pulled out, turning a patient, transferring a patient, ambulating, tubing near the floor, confuse patients. And sometimes your patients will intentionally pull it out. It does happen. You would think, oh, I wouldn't do that.
Mhm.
But it does happen on occasion that patients just, they're going to pull it out. This is painful for the patient, by the way. It's not horribly painful, over the top painful, but I mean, we're putting a bubble this big through a hole this big. I mean, you're going to have a little bit of tissue tearing. Now imagine peeing through that. You got torn tissue. What is that going to feel like? Yeah. So if we need another catheter, let's get it put in pretty quick so the patient doesn't have to have insult to injury. All right. So if a catheter does come out and you're allowed to document in words, if you go back and watch my last week's live, I talked about documentation. Most CNAs are not allowed to document with words in most settings. Numbers. We stick to numbers: pulse, respiration, blood pressure, food intake, fluid intake. Most of what we do is numbers based. But if you do have to document with words, you would keep it short and sweet. Facts only. Catheter found lying in patient's bed, catheter and balloon intact. Okay. You're going to make sure that it goes into a bag for the nurse to be able to assess. Okay. Good.
We have a patient that has it's not a cataract, but I don't understand the name of it either. And we've been told many times like it has to be low. Other people tells me it's supposed to be up, and then I've been told that the fluid travels back and forth, that it's like some acid reflux or something. It's connected towards the stomach. So we don't know, like CNAs, we don't know what we're supposed to do when we place the patient in bed and where to put it.
Yeah, you're going to need to get clarification from the nurse. I don't know. I can tell you two potentials.
Yeah.
Actually, I could probably tell you 8 potentials.
But it's a lot it's a lot thinner. I don't know. It's just like when the liquid comes out, it comes out brown.
Yeah, it sounds to me like it may be a peritoneal dialysis situation where we're filtering the blood using the peritoneal cavity, which we take the patient's. It's an in and out system, like what you're describing. But I don't know for sure that that's actually what's happening. It could be a nephrostomy tube, which is not it's a catheter, but it's not going in the urethra. It actually goes directly into the kidney. It could be a suprapubic catheter, which is one that, a little tiny incision and we go right into the bladder from the outside. So there's a lot of possibilities, a lot of variables there. It could be a feeding tube of some kind. I don't know.
Yeah, no, not a feeding tube. It's just like for me, like if you have brown liquid coming out of your stomach that has like kind of like flakiness to it shouldn't go back in your like body. But I don't know. I've been told so many different things from different nurses, and
Kind of scary because you don't know who to trust.
yeah, it's
Yeah. It does sound to me, just based on what you described, that it could be a peritoneal dialysis situation because we're filtering the blood using the abdominal cavity, right? Because our kidneys aren't working properly. So it sounds to me like it could be something along those lines. But it also sounds like it could be a potential ostomy situation where it's feces, not urine that we're dealing with. And it may be an irrigation system that it's an ostomy that's being irrigated consistently. I don't, like I said, there's so many different variables there. And each one is going to have to be handled just a little bit differently. So try to find a nurse that you trust.
It's like the same color as well. So it's, I don't know, it's just weird.
Yeah,
It just gets a little confusing, not knowing what to do with it.
sure, absolutely. And you're not getting good clarification from your nurses, which is very
least I'm
sad.
not for it.
Yeah.
And the nurses confuse themselves. They're like, no, I'm pretty sure. Okay. Yeah, it's like
Somebody
But
should
it's
be getting
just
some
like everything else
clarification.
everything goes well, but it's just like that one thing. I don't think they're themselves very experienced with.
Yeah, that's what it sounds like. So their responsibility is actually to find somebody more qualified to train them so they could train you. So it sounds like there may be a step being missed.
Yeah, I keep it on the side below, like Catheter would. I keep it a little.
Yeah,
in
we
case.
do often put it on the bottom, but I've seen other people put it on the top.
I don't know.
It's just I just wanted to know what it was. Right?
I'm not sure.
I asked, but like,
Yeah, I'm not sure. My first guess would be a peritoneal dialysis. My second guess would be some sort of an ostomy, super high up in the digestive system. So it's all still liquid.
a G tube would be.
Yeah. It could be an ostomy that's being continuously flushed. I don't know. Because ostomy is high up at the beginning of your digestive tract. Everything is going to be liquid coming out, nothing formed. So it's all going to be liquid coming out because things get formed in your small intestines and then your large, right? So we extract all the nutrients in the small intestines and absorb water, and then your large intestines, everything kind of gets formed and compacted and all of that. So if it's an ostomy at the very, very beginning of the whole system, everything coming out is going to be liquid because it hasn't had a chance to, to go through the whole digestive system. So it could be a situation like that. I don't know.
Yeah, you have to look at his chart and everything.
Yeah, I'm not real sure. And it may be something that I'm not even all that familiar with. In that case, I would be calling the doctor and saying, what are our responsibilities here? What do I need to do for staff training? What are some things that we need to be considering? High, low, gravity fed, if it's an irrigation system, then yeah, putting it up high makes sense because we're irrigating, because it's at the very beginning of the digestive tract, everything's liquid, but it's very, very acidic, very acidic. So we may need to, have a flushing. So yeah, it could be a lot of different things.
Makes them gag a lot too. Like
That could be his underlying condition. I don't know. But it could be his reaction to the process too. I don't know.
he also does it when he's mad. But anyway, let me stop talking about him.
Yeah. Yeah. They all have a way of making their thoughts known. Nonverbal cues.
Oh yeah.
All right. So any questions on catheters? Any questions on catheters? This skill,
When you said about the tubing on the bed.
we're going to go over that in just a minute.
Okay,
Yeah, the actual cleaning part,
no, talking about, you said it has to be.
coiled on the
coiled
bed. Mhm.
What that mean?
Like this. this isn't a great picture, but you don't want it hanging off of the bed. You actually want it coiled like
Like a
on.
Circle,
It doesn't matter as long as it's not near the floor.
and it can be hanging like that.
Yeah, as long as it's not like coiled near the floor. So here, let me show you. This is our drainage bag. It is attached to a non-moving part of the bed here. Okay. And this is the tubing that is going to connect to her catheter. So, and it would already be connected. So we're going to pretend it's connected. So this is what it would look like on the bed. Okay. We don't want it. So this one doesn't even really go down there anymore, but you don't want it down there like that.
That's what-
Yep. You want it actually on the bed.
that's what, like, it's like hanging.
Yeah. And that's just basically to show the tubing
Oh,
itself. So I'll rework that image.
and would it be like, instead of in between, you can't, not over the thigh.
You can have it over the thigh. There are catheter holders. So there's small Velcro straps that go around the thigh that hold that catheter in place. That's an awesome thing to have. Not all settings have them. Some places will use tape to hold the catheter in place as well, just to try to prevent it from moving around a whole lot. But every setting's a little bit different in what they have on hand for us to use. But yeah, catheter leg wraps do exist. So over the leg is fine. Under the leg usually can compress it. So we try to prevent that just so that the flow is good.
So not in between, in between, no.
It's okay to have it in between the leg. I mean, it's okay. It depends on what position the patient's in. If they're laying on their side, then yeah, it's going to be in between the legs, but try not to have it compressed. Okay. Basically you just want it to in a position where it can flow. The urine can flow out of it. Well, remember the bag is lower than the hip, so it's not going to go back in. Everything's going to come out and flow downward. Okay. All right, so here's our care plan for this skill. It says provide catheter care with soap and water to a female resident with an indwelling urinary catheter. Clean the catheter tubing and perineal area only. That's it. Tubing and the peri area. So we're going to follow the care plan. We're going to do our opening. We're going to wash our hands, get our barrier, gather our supplies, not holding anything up next to us. We're definitely going to need gloves because we're in a personal skin area. Patient's going to be uncovered and undressed. So what do I need? Privacy blanket. If I'm going to turn the patient over to put a chucks underneath them, I've got to skin toward me first before I roll them over. To put a chucks under the patient, I'm going to roll it toward me first and then unroll it under the patient, right? Whatever we wash, whatever we rinse, we dry. We're going to check the water. Who else checks it? The patient. Do we put soap in the basin? No, it goes on the washcloth. Make sure your washcloths aren't drippy wet. We're going to use the leaves method again. When we're all done cleaning, we're going to put all the linens and dirty linen and clean the basin the way we clean everything else. And then we're going to do our closing. There is nothing new for you to learn other than what a catheter is and how it's used. You've seen this before. So we're going to clean the peri area for peri care, but we're also going to clean the tubing that's exposed. Now, if I'm going to clean this tubing, this part's in the patient, okay? If I'm going to clean this tubing, I always want to wipe away from the urethra, so down the tubing, and I need to get down about 3 or 4 inches. I just clean the whole thing. I'm right there. So just clean the whole thing. And we want to use 4 leaves. So we're going to clean once and fold it. clean twice and fold it, clean 3 times and fold it, clean 4 times and fold it. And then we can rinse and then dry.
What time zone is?
Doesn't matter. The biggest thing is I always teach you rinse the same way you washed, just to make it uniform and easy for you. So you never have to remember what you're doing. Repetition, but they're not grading. They don't care. Okay. Good. Not a hard skill. So let's real quick, before I show you this one, because I want to show you these 2 skills back to back. Remember, these are 2 separate skills for the test. You have catheter care and you have drainage bags. You've got to do your opening, catheter care, closing, opening, drainage bag, closing. Counts as 2 skills. Okay. Let me explain to you a little bit about drainage bags. So this just shows you, as you are cleaning the catheter, you want to make sure that you're holding it where it exits the body so it doesn't pull on the inside and injure the patient. So go to page 117. We're going to talk about drainage bag. And this care plan tells us to empty the resident's drainage bag into a graduate container and measure and record the urinary output in mLs or cc's on the intake and output form. So you can actually see the intake and output form in the middle of the page there. Remember, it's also on page 123, I believe, in your skills book. You can take a look at that. But all we're doing is emptying this bag and measuring the contents and documenting that. That's it. Nothing really to do with the patient. But when you're emptying that bag, you do want to look at the bag to make sure that the tubing is on the bed, it's not near the floor, that it's not being pulled on. You know, take a quick look and make sure everything is good with the patient and the catheter. But there's very little to do with the patient with this skill. You're going to do the opening and the closing, but everything else is in the bag. We need to empty that bag into a container. Okay. Remember, I said there's only one place that bacteria can get in from a CNA standpoint. We only deal with one place on the bag that we open, and that's the port at the bottom. So the name of the game here is that port can't touch anything, nothing. Can't touch your hand, can't touch the floor, the container, the chucks, the bed, nothing. It's got to stay clean. Now, we used to alcohol the ports, but what we found is alcohol is a drying agent, dries materials out. It was drying the plastic out so much that it was cracking, micro cracks. And what do you think likes to live in micro cracks? Yeah, pathogens, absolutely. So this is the urine cup that we're going to use. It's called triangular graduate container. It's marked in cc's and ounces, but in healthcare, remember, we use cc's, right? So if you look here, you'll see it's denoted in 50s. So there's 200, 250, 300, 350, 400, 450. These little lines in between are 25s. So if we have the line here for 200, there's 225, 250, 275, 300, 325. We're going to round to the nearest line. Doesn't matter whether it's up or down, just whatever you're nearest to. And that's what we report. Do not report 462 cc's. You are not that, precise here. So you need to be measuring by 25s. Okay. All right. So there's a couple different types of bags. This is the one that we use in testing. This is the same one I have down here. This is the port. It lives in like a little plastic flap here. So we have to bend it to get it out of the flap. And then there's a T valve. So can you take it out of the little sleeve?
You want me to pull it
Yep. Take it out of a sleeve. So you're going to bend it. Here, hold on, I'll show you.
I'm sorry.
Oh, geez. Okay. So this is our bag. This is our tubing and our catheter, which is in the patient. We're not going to worry about that right now. This is our bag. This is the port.
Okay.
If you just pull it down, it comes out of the little flap.
Oh,
This is a T valve. So we just slide it to the side to open. That's open. You can actually see through it. That means urine's going to come out. When we're all done, we're going to slide it back to the side to close it. Always want to leave it in the closed position so bacteria can't get in. And then we're very carefully going to slide it back up into its little house without letting it touch anything. Okay. No wiping. No. We found it's actually counterproductive. There are different types of bags too. So if you go to page 116, you'll see a leg bag there at the top of the page. This is a smaller, narrower bag. This is usually worn by patients that are out and about in the community. It doesn't hold as much urine, but it is easier and more discreet because you can hide it under clothing a lot better. Okay. You will also hear those called stadium bags as well. So the smaller portable urine bags, those are called stadium bags or leg bags. Patients can go into the bathroom and empty these just like you would empty your bladder. You know, you just hold it over the toilet and empty the bag. At the bottom of the page, page 116, you see a different type of catheter. This is a Texas cath or external cath, also known as a condom cath. This is something that goes for men only, goes over the shaft of the penis, and it's sticky, so it stays in place for like 3 days. And it allows the urine, when the patient urinates, to be diverted down a tube and collected into a bag. But there's some drawbacks to this. It's designed to stay in place for 3 days before it gets changed, but you have urine right at, you know, where the port comes off. You can see there, you know, the little thing that sticks out. We're holding urine there all the time. This is very sensitive skin. And remember, adult urine is acidic. So when you change these every 3 days, you've got to do really, really, really good skincare. Make sure it's very, very clean and dry before you put the next one on. Okay.
So they don't stay on as long as
3 days. Yep. 3 days. Those are called external catheters. So once we've drained the bag, the urinary bedside bag, into the graduate container, we want to use a chucks on the floor just in case we drop, you know, you don't want any urine on the floor. So we're going to put a chucks there, put the container there. We're going to empty the urine into the container, close the valve, put the little thing back in its house, just like I showed you. But then we're going to take this to the bathroom to measure it. We cannot take an open container of urine through a room. We know that with bedpan. So we're going to take that chucks and wrap it around our container to take it to the bathroom. Now, when we measure this, it's very, very specific. It has to be on a barrier, on a flat surface, at eye level. All three of those checkpoints are on one line. So if you miss one of them, you've missed all of them. On a barrier, on a flat surface, at eye level. Nope, you have to be down. So we're going to put this on the seat of the toilet, you know, the lid of the toilet. We're going to unwrap it like you see here. And then we're going to get down eye level and see, you know, round this to the nearest line. Okay. And then we're going to document. So this is our intake and output documentation form. Is urine intake or output? Oh, I hope so. Don't get that wrong. If you document this in intake, you will fail. Because I guarantee you the patient did not drink that urine. I guarantee it. All right, any questions? If you document under intake, that's what you're saying, guys. That is exactly what you're saying. So be careful. All right, I'm going to show you both of these videos, one right after the other. Because they have good close-ups. We'll be going on break in just a few minutes.
I wish we had this class 2 weeks ago, otherwise I wouldn't have had to self-train on YouTube like you said.
Oh, boy.
Early in the morning, I woke up and I went, damn, I gotta empty it.
Hey, look it up.
Yes.
All right, so you can see catheter care takes me a little over 10 minutes, and that's with both the intro and the credits. It's plenty of time. And then emptying the drainage bag is done in less than 5. These are not long skills. And remember, you already know all the principles.
My name is Patti. I'm in CNA Training. How are you? Good. I'm just Catheter. Is that okay? I'm going to close your curtains, wash my hands, get my supplies, and I'll be right back. Okay, Miss Jones, I'm going to gather my supplies. I'll start out with a barrier that provides a clean place to put my supplies. And we're going to get 4 washcloths, a towel, a chucks, a privacy blanket, and now I'll gather my basin and soap. And a set of gloves. All right, Miss Jones, I'll just get some water. I'll be right back. Okay, would you like to check the water temperature and make sure it's okay? It's good? Good. I'll place the washcloth in there to stay warm. And I'm going to cover you with a privacy blanket. This is going to help protect your privacy and keep you warm while we do this skill. And I'm going to pull your sheet down to about your knees. Okay, Ms. Jones, I'm going to place this pad underneath you. This is going to help keep your bed dry while we do this skill. First, I'll roll it toward me. And place it on the bed. And then I'll put my gloves on. All right, Ms. Jones, can you scoot toward me, please? Thank you. And can you roll onto your left side? 1, 2, 3. Thank you. Going to be very careful, making sure that the catheter tubing rolls with the patient and doesn't get pulled on. I'm going to unroll the chucks underneath the patient's hip and have the patient come back onto their back, making sure that they don't lay on that catheter tubing. Ms. Jones, can you scoot to the middle of the bed, please? Thank you. Ms. Jones, can you scoot toward me? Thank you. And roll up onto your right side. 1, 2, 3. And now I can unroll the chucks to protect the bed. Come on back, Ms. Jones, and scoot to the middle of the bed. Thank you very much. Okay, now I'm going to start cleaning the catheter. I'm going to roll your gown up inside the blanket. I will be exposing you, but we'll make this as brief as possible. Please let me know if you're uncomfortable. As I roll the gown in the blanket, I want to make sure that I don't grab the catheter, that we don't cause any unnecessary pulling or stress on that catheter. And now we'll cover her thighs with a towel. This exposes only the area that we're working on. I'm going to take the first washcloth and wring it out. And apply soap to 4 leaves. 1, 2, 3, 4. Now I'm going to clean your catheter. I'm going to hold the catheter where it exits the body, wrap the washcloth around, and wipe away from the body. Fold that leaf over. I'm going to hold it, wrap the washcloth around, and wipe away from the body. That's 2. We're going to do this 2 more times. Away from the body. 3. And the last one. 4. I'll set this washcloth aside. Whenever we wash, we must rinse. So I'll wring this washcloth out, and we'll use it to rinse that catheter the same way we wash. I'm going to hold it where it exits the body, wrap the washcloth around, and wipe away from the body. We'll do this 4 times. 2, 3, and 4. Set this aside. Now we'll dry the catheter. Now we're going to do peri-care. We'll take a washcloth out of the basin, wring it out really well. And we're going to soak 5 corners. 1, 2, 3, 4, and the back side is 5. Okay, now I'm going to clean the peri area. I'm going to lift the catheter up out of the way with my pinky and hold the labia open while I clean down the center with the first leaf. Always going top to bottom. And then we'll remove the washcloth and fold that leaf over. Now I'm going to clean down one side of the labia, top to bottom. Fold that leaf over. Clean down the other side of the labia, top to bottom. Fold that leaf over. I'm going to clean the skin fold between the groin and the leg. Fold that leaf over. And clean the other skin fold between the groin and the leg. And then set that washcloth aside. I'm going to take the final washcloth and wring it out really well. And we're going to rinse all of those areas the same way that we washed them. So I'll fold that catheter out of the way and spread the labia open, cleaning down the center, top to bottom. Fold that leaf over. Clean down one side of the labia. Fold that leaf over. Rinse down the other side of the labia. Fold that leaf over. We're going to rinse the skin fold. Fold that leaf over and the other skin fold. Set that aside. Now we'll dry gently by patting dry top to bottom and then removing the towel. I'm going to cover you back up. We'll unroll that blanket, which will replace the gown over the patient. I'm going to make sure that the catheter and the tubing is coiled on the bed, not near the floor and not where the patient is laying on it, making sure it's not pinned. Ms. Jones, I'll be right back. I need to dispose of your supplies. The towels and washcloth will be placed in dirty linen. The basin is going to be cleaned the way we clean everything else. We'll return the basin to the drawer, and on the way we'll pick up the soap. We'll open the drawer with the paper towel. Return the basin to its storage area. Now I'll dispose of my paper towels. Okay, Ms. Jones, I need to remove the chucks from under you. Can I get you to scoot toward me, please? Thank you. And can I get you to roll up on your left side? 1, 2, 3. Thank you. I'll roll this soiled chucks toward the patient and tuck it under her hip. Come on back, Ms. Jones. And scoot back to the middle, making sure the patient is not laying on that catheter tubing. Okay, Ms. Jones, can you scoot toward me again, please? Thank you. And roll up on your right side. And I'm going to remove that chucks from the back. Okay, you can scoot back to the middle. Thank you. This is going to be thrown away. Okay, Ms. Jones, let me just look at your catheter one last time. Make sure that the catheter tubing is coiled on the bed, that the catheter is not on the floor. Everything looks good. I'm going to remove the chucks from the table, and we're going to throw this away. And then I'll remove my gloves. We'll throw those away. Okay, Ms. Jones, I'll pull your sheet up now. And I'll remove the blanket as I do so, rolling it into a ball. We put this in dirty linen. Okay, Ms. Jones, here's your call light. If you should need anything, just let me know. Are you comfortable? Can I get you anything while I'm here, like a magazine? I'm just gonna open your curtain and wash my hands. After washing my hands, I'll think about the steps of my skill, make any corrections that need to be made, and then tell the evaluator my skill is done. Okay, so that was catheter care, and this is drainage back. Hello, Ms. Jones. My name is Patty. I'm your CNA today. How are you? Great. I need to empty your urinary drainage bag. Is that okay? Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. For this skill, I'll need a barrier, which I'll place on the floor under the drainage bag. I'm going to need a set of gloves. And I'm going to need a triangular graduate container. I want to inspect the catheter tubing to make sure that it's coiled on the bed and the patient isn't lying on it and it's not pink, but also that it's not hanging near the floor where somebody might get their feet tangled up in it and trip or accidentally rip the catheter out. This catheter looks like it's in the appropriate position. We'll now remove the port from its protective sleeve on the back. Sliding the valve to the side will open the port. We can now position this open port over the graduated container and tilt the bag slightly to the side to allow the contents to drain into the graduated container. While doing so, we want to be careful not to allow that port to touch any other surface. Once the urine bag has been emptied, we'll slide the port back to the side to close it and very carefully insert it back into its protective sleeve. We want to make sure that the bag is hanging on a non-movable part of the bed and it's not touching the floor. We can now fold the tucks over the graduate container for safe and secure transport to the patient's bathroom. Once we're at the patient's bathroom, we're going to set the graduate container down on a barrier on a flat surface and position it so that we can read it. We need to be at our level, and we're going to round to the nearest line, either up or down. You can see that the urine in this container is nearest to the mark of 425, so the amount that we will document is 425 milliliters, 4 cc's. Once we've measured it on a barrier, on a flat surface at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down, use a paper towel to pick it up, paper towel to dry the outside, paper towel to dry the inside. We'll discard this and then one for the drawer. We're gonna place the graduate container in the bottom drawer and close the door with paper towel. Okay, now I'll throw the paper towels away and remove my gloves. We'll throw those away as well. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? A magazine perhaps? You have your call out there. If you should need anything at all, please feel free to let me know. I'm going to open your curtain, wash my hands, and document my skill. Thank you. After washing my hands, I'll document on the intake and output sheet that the evaluator gives me. I'm going to document the time of output, the type of output, which is urine, the amount of output in CT, and my initials. After documenting, I'll review the steps of my skill, make any corrections, and then tell the evaluator my skill is done.
Do you have to, like you put your time, you did the military time, do you have to do that every time?
No, you do not have to use military time, but you should, because military time is used in most clinical times. So. Anyway. Can you turn that light back on, please? So you should learn how to do it in your white skills book. I think it's on page 23. I think I have a whole lesson on how to create military time.
Always is military, so.
Yeah.
I know how to.
Yeah. Yeah, people think military time is so confusing to learn, but I actually want to know who the wise guy is. It said, okay, we're gonna, for hours, there's 24 hours in a day, we're just gonna count to 12 and then we're gonna start over again. Who was the wise guy that thought that was a good idea? You know, if there's 24 hours, let's use them all. 1 to 24, and that's all military time is. That's it.
0, 0
13, 25,
to 23, 59.
Yeah.
What, 0, 0?
12.
0, 0
Midnight.
is midnight. It's.
That's when the
22.
new day, yeah, the new day starts.
So 12 o'clock, I mean, 0, 0, 1.
1, 2, 3, 4, 5,
Right.
6, 7,
That's
8, 9, 10,
AM.
11, 12, 13, 14.
That's
So by
eight.
the time it's like 1 o'clock in the afternoon, it's 13.
Right.
Yeah, like
Okay.
1306,
Okay.
106,
12
1307,
Yeah.
107.
Yeah, we don't start over again. We just keep going.
And the easiest thing my mom told me is after 12 o'clock, the second number, like say with 13, so track the 3 from 2 and you get what your actual time is. That was the easiest way my mom taught me. Cause I was like 6 when she started teaching.
Yeah, everybody has their own little memory tricks for that.
And like 23, you just subtract it by 12.
Right. Right. You add 12 or subtract 12 to the number. Yeah, the first number. All right.
Remember for daily time.
No, Page 23 explains it a lot clearer.
Cause like after 12, it's 1, which is 13, and 2.
You just keep counting. You go to 12, so the morning is all the same. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Now, at 12 noon, normally you would start over 1 p.m., 2 p.m., 3 p.m., right? We don't start over, we just keep counting. So 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23.
0, 0.
And then we're gonna start the day again at midnight, so that zeros, because we're starting the day again, a new day.
1 o'clock.
0000 is midnight. 0100 is 1 o'clock in the morning.
Oh, okay.
0200 is 2 o'clock in the morning.
And you may
Okay,
get some
okay.
people say like, oh, 800, which is just 8 a.m.
Zero in the front, and then the minutes in the back.
12 o'clock. 0. I
Do,
understand.
yeah,
Yeah,
do the
I
lesson, it will make more sense to you if you go through that lesson step by step.
Yeah.
Like it's odd for me to not have anything in real estate. That's what my comes in. So it's like. I see other people's stuff.
I think it was 23, let me just like verify that page. 29, sorry, 29. Page 29. All right, any questions on, what we've gone over today? All right, we're done with the skills. Let's go ahead and take a break. When you come back, don't leave right now. When you come back, I'm gonna give you your review sheet, but I'm also gonna give you some instructions for, Wednesday's class as well. So there's a couple things you need to know about Wednesday's class, but I need to get paper for my printer, so don't go anywhere, but take a break.
No.
Oh, like we, okay.
That.
Alright.
What? Just some recent school though.
Wanna go with my fancy cars?
What the what? What the what? What the what?
That's my brother.
No, like, don't like leave, like go home. Like you like go home.
Oh,
Go
we'll get
home.
there.
Yeah, like, you can get whatever. just don't get-
Oh, we still, so we're gonna be off again.
Curvy, right? I'm curvy or today. But this is the scary part. I have to make sure that I'm place you can go to work out. I think in the line of like danger. Yeah, street danger, like she could overpower me in a second. So it'll be like. He's so nice. I'm gonna be like, oh my God, it's so nice to meet you. That's funny, right? Online, Tinder. That's who my Cassie met the wife. And my Miranda met a super on honor and was on Tinder. Really, they both did? They both did. Yeah, yep, Tinder, get on there, girl. We're not dead. No, we're not dead. And you know what? Huh? I couldn't shut off working. Not no more. Yeah, not no more. What's the other one? Oh, wow. Yep. Go on. Go on. And I want your phone number, because I want you to keep in touch with me and let me know.
Is that,
Okay, it says that you need your fingerprints. If you ever, they want to look on. You know the paper that I gave you, the one, the sideways one? Put all the text information on it.
Yes,
Put the four, got that one, the first column. If that's, that brings me to, if we go to that, the blue lane right there, office.com.
I did, and it would be nothing. That's the next step.
Shoot.
God bless.
Yeah.
I went to Google.
I had to look up the class. So you're on our site.
Okay, so where is?
You don't need to go to Google. So bring your phone over here. Okay, so here, CNA skills videos is gonna show you the skills video, what we've seen in animated lessons. These are all the things I talk about. The online course is there. Classroom info will be upcoming classes. You don't need that. Practice tests. Your ideal workplace. So you just click on these. So if you want to watch videos, go to this one. Oh, the eBook? Okay. Okay, so you need help with the background check?
I just probably am. I'm pretty sure.
If you would put all my kids together.
Oh,
Good.
yeah,
He's
yeah,
having
all
a
of us together. That's okay.
We all got a little bit.
It's a gift.
Yeah, I hate it.
Look at it like a gift.
I'm just happy that I wasn't ever diagnosed because I can't be thankful for it.
Oh, you might be diagnosed. You better wait. Don't you have health insurance that they could
I do.
like put you? I don't.
I'm on my mom's. And I'll
Yeah,
have it
I'm
until
not.
I'm roughly like 25 years old. I'm set for like the next year.
That's good. I haven't seen a doctor in 8 years. No health insurance.
So,
And then I got old.
you'll be.
So that's me. To learn how to take care of my mom. Main concern, and I've been able to implement a ton of these skills this last couple weeks, because mom's all jacked up. But, yeah, health insurance,
I have a lot of family
doing
members.
grown up punching stuff, you know?
I have a lot of family members who use health, and that's one thing that I got into. Thank you. Yeah.
Now,
These
this
are my
is-
favorite. I love the issues.
Do you?
Yeah, I don't mind them either.
I
It makes
do
me
like
feel like I know what I'm doing.
That's right.
I know, it confirms that I'm hearing things I'm supposed
I
to.
keep reading it, and I'm just like, shh. And I'm like, oh, yeah,
Yeah.
I am retaining it.
You are retaining it. I have a job alert. I got a phone call this weekend from a local physician's office who is looking for, they have an infusion center. They're looking for a CNA, does not need to be certified. She contacted us to see if any of my current students would be interested. It's an 8-hour shift. They operate 7 days a week, 365 days a year. But they're open from 4 AM to 5 PM, but you'd only be working an 8-hour shift somewhere in those working hours. The information is here. I'm gonna put it up on the bulletin board and you can take a picture of it and apply if you're interested.
Where's
Where
it
is it at?
located?
It's on 50.
Oh, it's closed.
Is it evergreen?
No, it's doctor's office.
I've had a lot, I live in that certified longer community.
Yep,
There's
those are other
more
ones.
people. It makes me so sad.
Now, do you have any certification for these other ones?
You don't, nope, you do not need to be certified.
I do have a question.
They may require certification at some point, but not to start.
So, actually, I figured out, my cousin that was in the class is actually a PCA. What's the difference between a CNA and a PCA? They make their own schedule, don't they?
No,
She's
PCA
not
is just a name, okay? So the only people that can call themselves CNAs are those that have taken the state exam and earned that title.
Yeah.
Okay, so certified. CNA is certified nursing assistant. Anybody else will have a different title. Nurse tech, patient care attendant, patient care assistant, personal care attendant. Yeah, there's a million different terms. Every facility is gonna make up their own.
Cause I was talking with my mom about it. She's like, it sounds like she failed her test possibly if she's taking it.
Possibly, or maybe she didn't need it at all.
It's
Because you
possible.
don't need to be certified. The only places legally, from a legal standpoint, that you have to be certified to work is in a nursing home and in home care if you don't have your home health aide.
In a hospital? Now,
That's it. You do
senior
not
living?
have to legally, you do not have to be a CNA to work in a hospital, a rehab, a mental health center, a doctor's
Or
office, a
senior
walk-in clinic. What?
Senior living?
No, you do not have to be certified. So a lot of people just decide not to take the test, right? Because it's not required for where they work. It's possible she failed. Yeah, I mean, it is
I
possible.
just don't, right now, I'm not on the greatest terms with it, cause we got into a huge argument. But we still talk like about like this kind of stuff. And she was like, I'm a PCA with Biocoast Senior Living. She's like, we are in need of people right now. She's like,
Oh, yeah,
and if you take his test and pass it, you'll be at a somewhat higher rank than I am,
right.
is what she was saying.
Yeah, you don't have to be certified to work there, but if you are certified, you get a higher rate of pay.
So just say like I took the test and I failed. I could still go somewhere and be like a assistant nurse.
Yes. Yeah. So pretty much the same thing, you just won't have your certification.
Oh, okay.
You have the skills that you need and all of that, you just won't be
Right.
certified.
Not every place requires certification legally.
Okay.
So nursing homes and home care, if you aren't a home health aide, does require it. Other than that, they can call it whatever they want, they don't require certification. Now, that's legal, that's from a legal standpoint, but let me explain to you employer options. Just because you don't legally have to be a CNA to work in a hospital, doesn't mean that Oak Hill, it hasn't made that a requirement for their institution. Okay, so you've got legal principles, and then you've got employer options. The employer can mandate anything, they can say, this is all that I'm looking for. I only want people with this qualification. And that's an employer's prerogative.
Now say I did take what she's doing right now before I take the test, and I take the test and I passed it, would that change my rate and pay?
Most likely, yeah. And most of them will tell you you'll go up X amount of dollars once you get your certification.
Certified.
Right.
So I may do that, because, she said it's like the best place she's worked. Obviously, like, she's like me, she's worked in pretty much restaurants until now. And she's like, all the people there are like very nice, and the, what's the word I'm looking for? I can't think of the word I'm looking for. I can't,
Like the nursing supervisor
like,
or,
everybody's like pretty much like helpful in a way.
oh, okay. Like patients or staff?
Everybody.
Oh, okay.
So they all like work together with you.
That's good. Yeah, getting in somewhere that has a team dynamic is very helpful.
And that can start me off, and then once I actually get my CNA, then I can probably go further into pediatrics that I want to be. So, but it would get me starting off, I guess.
Yeah, it would get you some experience. Yeah. All right, so, for those of you that did not know, I posted a job opening. It's the, ID or index card up there with the red writing on it. It is a local infusion center. She is looking for current students. You can take a picture of it and apply. We get, every week I get employers that contact me, guys, it's not gonna be hard to find a job. It's not gonna be hard at all to find a job. They're all begging for you. So there's a lot of openings there. Now, on Wednesday, when you come in, you need to bring your blue book back. Unless you purchased it. Bring your blue book back. The white book is yours forever and always.
How much is it?
$25 if you wanna buy it. 20, 20, okay, 20 if you wanna buy it. It's normally 42. I'm giving you guys a huge.
Do I just go over there and?
If you have cash, pay me.
Okay.
If you wanna pay by card, yeah, go over and see Jake, cause it takes me too long to pull it up
Okay.
here.
Do they have the CNA jobs over at the veterans hospitals?
Yes, yes. If you look at, we have a veterans hospital in Tampa and one in Gainesville. Both of them are hiring. It's on their website. And I'm gonna be talking to you about finding jobs on Wednesday. I've got a whole presentation to give you, but go onto the website for the VA hospital. We also have VA nursing homes that are hiring. They contacted me probably about a month and a half ago. So,
Cool.
Is there any ones over in Spring Hill or Fort Ritchie?
not that I'm aware of.
She's just looking jobs.
Yeah, hospice hires.
I think
Absolutely.
I saw a big old sign out there.
They do, they have a
That's
sign
why I
out
wanna
front.
go,
Yeah.
Jobs right up there.
Oh,
Yeah, 50, I think she said.
Yeah, when you, I'll talk to you on Wednesday, but if you go on my website, under after certification, I've got a local jobs board. Every single employer, healthcare employer is on that jobs board. If you click on it, it'll take you directly to their website where you can apply. I've done all the work for you.
I took that quiz, like that little quiz on the bottom that like, not places you, but you know, that like suggests, right?
Yeah,
Where they
the
think,
help, the ideal workplace quiz.
yeah, so it
Okay.
said peds for me. I don't know how I would do it, kid. I work with old people now and I kind of like it, but I don't, it sounds like a big, right, compared to.
If you like to see progression, see people getting better, pediatrics is a better place for you.
That might be it. That might be why.
Yeah, because with aging is a progressive, debilitating process.
Right.
So if it, if you need to see progression to keep yourself upbeat and motivated, sometimes working with, older individuals with chronic, always degrading and, declining and, you're watching that. If you don't have an upbeat personality, if you rely on external stimuli to keep your attitude up, that can really pull you down.
Okay, that makes sense.
So that might be why you ended up with pediatrics, because it does tend to be a little bit more uplifting.
Okay, that makes sense.
I know for a fact that's what I want to be. I've always thinking of it.
Yeah, we just need one thing, John.
Yeah, well, things like mine, but other people's kids, I'm like, no.
Yeah.
So that's why I'm like, oh.
I
Yeah,
worked
no biggies.
pediatrics for a long time in my career, and it wasn't the kids that were the problem.
The parents.
The parent,
Yeah,
yeah, it wasn't the kids.
yeah, they have a totally different outlook on life, so I get it.
Yeah, but dealing with parents, because it's their kid.
Right.
It's not the way I would raise them.
Right.
Their kids, so it's, it can be difficult when you're working in pediatrics to kind of toe that line where you're working in the best interest of the child, but you're not overriding the parents' rights as parents either. So like, for instance, I worked with a very brittle young diabetic boy. And his blood sugars were all over the place. Didn't matter what we fed him, they were up and down and all over the place. And it's very, very, very difficult to manage. Well, part of the problem was that the mom, because his blood sugar would go so low, the mom just got used to letting him have free reign in the kitchen. And he'd go in there and grab a candy bar when nobody was looking, and then his blood sugar would spike and then he'd crash. And it was really, really hard to keep him on a consistent diet because his mom just let him do, what he wanted to do in the kitchen. And, you let a 4 or 5 year old child into a kitchen and let them have whatever they want and have a whole drawer stocked, that they're going to take advantage of that because they don't understand long-term consequences. So, working with the parents, trying to educate them and get them to understand that while short-term it may be helping their emotional state within the house, long-term is causing a lot of damage.
Yeah.
So, a lot of times working with the patients is not as hard as trying to work around the other people
Yeah, that makes sense.
and still, have them involved in the care. All right, so the Blue Book comes back with you on Wednesday. On Wednesday, we are going over employability, where to look for jobs, how to find jobs in healthcare, because it's a little different than other industries. We're going to go over what you should do for interviews, how to renew your certification, when to renew your certification, what continuing education is and how to get it. So we have a lot of stuff to cover on Wednesday. I'm also going to give you a graduation folder that has some information in it. that's gonna be very important to you moving forward. And we will take a class photo.
Yay.
I do put it on, yeah, I do put it on Facebook, but I do not tag anybody. So you have to go to my Facebook page and, share it or whatever. If you like my Facebook page, it's just for your CNA medical training. It's easy to find, the number 4, YOUR CNA. But if you like the Facebook page, that way when I post the picture on Wednesday, you'll get it automatically in your feed. And it's also where I post all of these employers that contact me and say, hey, I'm looking for whatever. That's so if you want direct access to the most up-to-date job openings in our community, my Facebook page, because I've been doing this 15 years, they all contact me. That's probably the best way to find a new position. But we're gonna go over job searches and things like that on Wednesday. So that's what is on trend for Wednesday's class, graduation. You do have one chapter of homework tonight, and that's chapter 10. It's all on stress management and employability. So it's a short chapter, pretty easy. Shouldn't be too terribly difficult for you. Does anyone have any other questions? Any other questions? I gave you your review sheet for today. You should be able to answer those. And if you go back, if you've been keeping all of those review sheets from the beginning of the class, and you go back to the very first one and you read through the first review sheet, you should easily be able to recite everything on there. And then go to day 2 and do the same thing. It's a really, really good way if you put all of and you'll get one for Wednesday as well. If you put all 8 of those together, it is a great review of the entire class. So you can have that in your car before testing, when you're waiting to go in and test and just review it.
We don't have to bring a blood pressure cuff, right?
No, because blood pressure is not tested on the state exam.
Oh, that's right.
You do not have to perform blood pressure on the state exam, so no, you don't need to bring it.
It's called the respiration stuff.
Respirations.
Is that a skill set that they'll be testing too?
Yes. Everything that I've demonstrated in here, except for blood pressure, is tested on the state exam. Page 17.
Every skill stuff.
And every opening starts,
And what?
and every opening starts with,
A knock. Yeah.
You know, that ooey chooey, there was a question, and that's what I wanted to put down.
Really great.
It kept saying.
Yeah. But it is not a lie. I really.
Like infection control, that type of thing, right? I took that test, the mock exam on there. And of course, one of the 3 that I got wrong, so obviously I'm not nervous about the written. One of them was that because I accidentally forgot gloves go on after, not before.
because first thing your blood.
Would that have caused me to fail if I did that on the real test? Okay, good, now I gotta keep that in mind.
But I wrote in this.
The other 2 didn't seem that important, they were like tricky, like, do you pick up a rug off the floor or flammable object? Both of them sound, you know what I mean?
Oh, yeah.
Right, that was the only one that I was like,
I don't ever recall. Principal's review. Do you have another one? I don't know what or where or.
Yeah.
You don't.
Look, I don't think I did, but let me look.
I don't know why. Yeah, I don't know.
You got don't brag.
Oh, yay, thank you.
You're welcome.
Thank you, thank you.
All right, any other questions?
Yes.
Okay,
When we wanna know again, like, when you lay the patient down and you position all these pillows, I kinda forgot.
Okay, so you wanna scoot them toward you, turn them on their side away from you. You're gonna put a pillow behind their back and roll it. So you tuck one edge, roll it, tuck the other edge. One between their legs, specifically between knees and ankles. One under the top arm to keep it in a neutral position, and then you adjust one under the head.
So
Make sure it's under head and neck, not shoulder.
How many pillows? Is that 4 pillows?
So one is already on the bed, because their head is on it, and then 3 extra.
Okay.
But if you look on, whatever page it's on, it tells you at the top of the screen, or at the top of the page, what, supplies you need. So go to page 98. And at the top of the page, you'll see the supplies. So you'll see it says 3 pillows.
Okay, thank you. Do you wanna do that one?
All right, the rest of the class is practice.
Thank you.
Okay, you two people, we're signing off because it's practice. We will see you on Wednesday, 9 a.m. for graduation. Bye.
Position.